Hello, in this video, I will be talking about self-advocacy and breast cancer. Before I go on, I'm going to invite you to subscribe to our channel. We're always putting out new content. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. So what is self-advocacy? The word advocate actually comes from the Latin word to speak toward. So you're speaking in service of yourself. You're speaking up for yourself. Why should you have to do this? Well, because only you know your body. Only you know your experience, your questions, your illness representation. What does this illness mean to me? What do I believe caused this? The other thing is that as the world gets busier and people get what's called cognitive overload, we know that physicians are more likely to get burned out, and it's hard for us as physicians to pay attention. And it's not because we don't care. It's because of all the demands on our attention, from the EHR to new studies to somebody knocking on the door saying we're running late. It's really important for you just to help slow things down and advocate for yourself. What do I mean by that? I mean asking questions, asking what different words mean, asking about alternatives, asking what to expect as you move forward in your treatment. We use a lot of jargon. We use a lot of words like adjuvant, and we might throw around terms like ER and PR when you don't know that ER means estrogen receptor and that PR means progesterone receptor. And again, it's no fault of the physician or nurse or social worker, pharmacist, nurse practitioner, physician assistant. It's just we slide back into jargon. I'm sure you've done the same thing. Your work has its own jargon. But the key thing is this is your life, and you're going to make decisions based on prognostic and predictive factors. You want to understand why you're going through certain treatment. So it is totally okay to say to the person talking with you, could we slow down a little bit? There's some terms I'm hearing that I don't know. We actually love to teach. Most physicians, the reason they go into medicine is to be with you in the room. And those are really sacred moments to be with you. And meeting your information and emotional and psychological needs is the one thing I hear from physicians keeps them in the profession. They're in the profession to meet your needs and to help you get through a difficult time. So asking them what something means is not only your right, it's actually part of what makes the doctor-patient and clinician-patient relationship meaningful to everybody. So you can slow down and you can say, will this be in your note? Where can I go for more information? I'm confused. I'm getting really scared. I'm not actually hearing what you're saying right now. What do I absolutely need to know? Or, I knew this when I came in. I'd like to go a little deeper. You get to tell your team members, how's the information load going for you? Is it too fast, too slow? When you record a video, there's a thing that says speed up or slow down. We should be able to do the same thing with the people who are helping us take care of ourselves and are taking care of us. Another thing you want to be sure to do is understand why you're getting offered the treatments you're being offered. So why is chemotherapy part of your recommendation? Or why are you not recommending chemotherapy? Why are you not recommending implant reconstruction for me? Why are you not recommending tissue reconstruction with my own belly? Just asking those questions, saying, I really want to know. This really helps me to understand, and then ask your questions. The other thing, if you're thinking, I don't want this treatment, you can ask very simply, I would love to know, are there other options? Because between you and me, there are always other options. You can't really be forced into getting chemotherapy. You are a willing participant. You can be persuaded, maybe against your will, but it really shouldn't be done that way, right? You're signing a consent form. You're saying, I agree to get this. Before you agree to something, you should understand the what, why, how, when, and what should I expect. The other thing I want to encourage you to do is talk with your providers, your clinicians about your symptoms. A lot of people feel like, oh, they said that would happen and I'm getting it, so they know I'm having it. Well, we don't know you're having nausea if you don't tell us. And you don't have to worry about being a good patient, whatever that is. People are afraid if they talk about a symptom that they won't keep getting treated or the doctor won't like them. This is your body. It's your one wild and precious life, and we need to know what you're experiencing, and you need to be able to report your symptoms without being invalidated. I use the word report intentionally. A lot of people will say, I don't want to complain. Well, it's not complaining, it's reporting. How are we supposed to give you the best care without getting the best information from you? Now, this might be a time you want to go to Yerbba.com to get your personalized Yerbba report. What Yerbba does is, after you give permission, we'll take all of the medical records from everywhere you've had your treatment, compile them into one report. No matter whether you're waiting to finish additional tests, it takes all of that and then cross-references it with the latest medical evidence and gives you a report on not just what we know about your tumor, what is known about your tumor and what other tests might be done, but all of the treatment options you might hear about, the pros and the cons, all in easy to understand language, no jargon. And you can get this before you see your medical team or after you see your medical team. And then if you sign up for the premium version, you can also ask Yerbba questions where experts will help answer your specific questions about your specific case. So Yerbba.com to get your personalized report. I hope I've inspired you to be an advocate for yourself. You can also write your questions down before you go to the appointment. You can also bring someone with you to ask the questions maybe you didn't feel you could ask in those moments. So there are lots of tips and ways you can advocate for yourself as you move forward through your treatment and afterwards. As always, thank you for watching, and we'll see you next time.